Good evening friends, you are most welcome to Think Eyes channel. Today we are going to discuss Practicing Anthropology, which is written by MAAN IGNOU, and our topic is Physiological Anthropology. Let us begin the topic. Our heading is Heart Rate. The number of times a human heart beats per minute is known as the heart rate. Resting heart rate (RHR) is one of the simplest cardiovascular parameters, which usually averages 60 to 80 beats per minute (bpm) but can occasionally exceed 100 bpm in unconditioned sedentary individuals and be as low as 30 bpm in highly trained endurance athletes. However, rates below 60 bpm referred to as bradycardia and rates above 100 bpm referred to as tachycardia, a clinical heart disorder. Elevated heart rate greater than 80 to 85 beats per minute measured under resting condition is directly associated with risk of developing hypertension and atherosclerosis and is a potent predictor of cardiovascular morbidity and mortality. Palatini P. 2007. Epidemiological evidences demonstrate that resting heart rate, that is RHR, or its corollaries, namely post-exercise heart rate recovery, which is mediated primarily by vagal tone and heart rate variability. HRV beat-to-beat variability also mediated by autonomic nervous system, especially parasympathetic, correlates with cardiovascular morbidity and suggests that resting heart rate determines life expectancy. Cook et al. 2006. Heart rate proves to be the best predictor after myocardial infarction in patients with congestive heart failure as well as in patients with diabetes mellitus or hypertension. Designy et al. 1995, Hathaway et al. 1998. Resting heart rate (RHR) both contributes to and reflects cardiac pathology. Increased heart rate due to imbalance of the autonomic nervous system with increased sympathetic activity or reduced vagal tone has the impact on perfusion contraction matching, which is the dynamic that regulates myocardial blood supply and function. In the healthy heart, increased metabolism as a result of increased contractile function results in increased myocardial blood flow and to a lesser degree increased oxygen extraction. In the presence of coronary artery disease, perfusion contraction mismatching is localized to areas of inadequate supply. When coronary artery inflow is inadequate to meet demands, contractile and diastolic functions in the affected area are correspondingly reduced. An increase in heart rate results not only in an increase in myocardial oxygen demands but also a potential impairment of supply resulting from a reduction of collateral perfusion pressure and collateral flow. This imbalance may promote ischemia, erythemas, and ventricular dysfunction. This imbalance may promote ischemia, erythemas, and ventricular dysfunction as well as acute coronary syndromes, heart failure or sudden death. Arnold et al. 2008. Pulse rate. The stretch and subsequent recoil of the aorta wall propagates as a wave through the entire arterial system. The pressure wave readily appears as a pulse in the following hour. The superficial radial artery on the thumb side of the wrist, the temporal artery and carotid artery. In healthy person, pulse rate equals heart rate. Pulse rate. The stretch and subsequent recoil of aorta wall propagates as a wave through the entire arterial system. The pressure wave readily appears as pulse in following are the superficial radial artery on the thumb side of the wrist, the temporal artery and carotid artery. In healthy persons, pulse rate equals heart rates. Cardiorespiratory fitness. It is generally considered the most important component of health related fitness. Guillaume Chu Kuang, 1981. Guillaume Chu Keong, 1981. And remains a significant predictor of hypertension risk. McArdle et al. 2007. It is defined as the ability of the cardiorespiratory systems to respond adequately and safely to the blood, oxygen, and other nutritional requirements of the body organ and tissues, particularly the working muscle during physical activity. Higher level of cardiorespiratory fitness (CRF) often neutralize increased mortality associated with elevated blood pressure and reduced risk of developing hypertension among healthy normotensive persons. In other words, higher incidences of hypertension have been demonstrated among individuals with low fitness compared with fit individuals. Aina Emmaus et al. 2011. Physical fitness and physical